Welcome to Zambia, a country of stunning landscapes, vibrant culture, and resilient communities. But beneath its beauty, Zambia has faced significant health challenges. HIV, tuberculosis, and malaria have been relentless adversaries, but a powerful ally has emerged in this battle: the Global Fund. "20 years ago, HIV, tuberculosis, and malaria seemed unbeatable. In 2002, in an act of extraordinary global solidarity and leadership, the world came together to create the Global Fund to fight what were then the deadliest infectious diseases confronting humanity. Over the 20 years that followed, the Global Fund partnership has invested more than $60 billion, saving 59 million lives and reducing the combined death rate from the three diseases by more than half in the countries where investments were made.
CITAMPlus, we're actually a sub-recipient of the Global Fund, which means we receive funds from the Global Fund through the principal recipient here in Zambia, which is CHAZ, Churches Health Association of Zambia. And through that, we have been able to support community volunteers.
In the early 2000s, Zambia faced an overwhelming health crisis. HIV and AIDS prevalence rates were among the highest in the world, with approximately 15% of the adults living with HIV. Tuberculosis, often a co-infection with HIV, was rampant, and malaria was a leading cause of illness and death. Today, the landscape is different. Thanks to the Global Fund's investments, over 1.2 million Zambians are on antiretroviral therapy, cutting the HIV prevalence rate to about 11.3% by 2023. The incidence of TB has decreased by 50% and malaria mortality rate has fallen by over 60%. One of the key strategies has been the distribution of insecticide-treated bed nets. Over 30 million nets have been distributed across Zambia, protecting families from malaria-carrying mosquitoes.
We have trained a number of community volunteers who we call malaria change agents.
Turabasambirisha kunefe bafuire kuyisunga nefe bafuire kulalala muri mosquito net. Then nga twamula mukomboni turabasambirisha fyonse twabapera kunefe ya mosquito net bantu bali bala twafuirisha kuba Global Fund.
HIV testing and counseling has become more accessible, breaking down stigma and encouraging people to know their status. Prevention programs, including mother-to-child transmission prevention, have dramatically reduced new infections.
I'm a person living with HIV, as well as a person who has survived TB on 3 occasions. So basically, my personal journey has not been easy with regards to living with HIV and with the opportunistic infection of tuberculosis. And by the improvement of my quality of health through the Global Fund, in conjunction with our government of the Republic of Zambia, I'm able to play a significant role on the CCM, representing my constituency to ensure that the entire constituency of people living with HIV, could be the TB constituency, are receiving the best quality healthcare delivery they can from our government with the support of our donors, especially the Global Fund.
But this time, mangwala gali in stock. So, palibe shortage. So tiyamikira kwambiri chifukwa cha Global Fund yamene iliko yapepukisa vintu.
The other main one really for me is seeing people who had AIDS now just having HIV and not having those symptoms because of the ART.
Tuberculosis remains a challenge, but with the Global Fund's support, Zambia has improved its diagnostic capabilities and treatment adherence programs. Community engagement and education are at the heart of the Global Fund's strategy. Health workers are trained, communities are educated, and local leaders are involved in spreading awareness.
Timonga muno mutaoni bambiri baizi ba TB kulingana na caregiver amene tipereka utenga mu community kuti TB ni matenda ya so TB ipa ya TB chitachaso na chaso bambiri bankala awareness na TB.
So we also try and track those who are referred to care. For example, for TB, we have the presumptive register in the health facility. So that shows which people were referred to the facility by our community volunteers. and then that also shows us how many were cured.
Tumapempula munga mwamene nabwerera muno nabwera mukupempula la esinati tembo badwala balina 4 months bakumwama nkola ya TB imabwera mukubaona nga palina omuti fidafine nga takwete omuti tulema twasenda omuti okumuletera kaisaenda twaleta kuno beta beta cholivuta baningi ni mendo ya binei kwa siri mwane naambira kumwela nkola ya TB ndi kuona kwa ninaona kuti change ilipo baningi imwametusebenzera munga nkani ya TB.
The impact of the Global Fund extends beyond health outcomes. It strengthens healthcare systems, fosters economic stability, and builds hope for a healthier future.
So our interest is to just ensure that there is engagement and awareness from the communities that we've got the Parliamentary Caucus on Tuberculosis, which is an ally to the eradicating tuberculosis. I visited one health center in my constituency, Smauri Health Center. I deliberately took initiative to ask about tuberculosis, and I was surprised to find that they don't have a single case.
In rural areas, the Global Fund has supported the construction and refurbishment of health facilities, ensuring that even the most remote communities have access to quality healthcare.
Our Global Fund is playing a big role in improving services, especially here in Shazanga, in terms of providing us with commodities. We talk about lab commodities, talk about drugs, so patients easily access medication from here because it's near them.
This is a pharmacy, our bulk store where we stock all the drugs that we receive from CHARS, supported by Global Fund.
The Global Fund's impact is not limited to Zambia. In Zimbabwe, the Global Fund provides 21% of international financing for HIV programs, 73% for TB, and 56% for malaria programs. It has been a game changer. With the help of the Global Fund, Zimbabwe has transitioned out of the global list of high-burden countries for tuberculosis according to the new list released by the World Health Organization. As part of the Global Fund's 20th anniversary celebration, the Torch Caravan is one of the series of activities organized to highlight the lives saved and the progress made. The initiative, tagged From Cape to Cairo, was designed by the Global Fund Advocates Network Africa and its partners, starting from Cape Town of South Africa in June, navigating through several countries to Cairo, Egypt in December. The Global Fund's approach has yielded significant results across many countries, proving that with the right support, even the most daunting health challenges can be overcome.
We are appreciative of the Global Fund, the resources that we've received from the Global Fund that enable us to do this work, that enable improve people's lives, that enable mothers to become grandmothers, to see their grandchildren.
But mwandi inenipemba chabe kuti basalekere paliyine. Salekere paliyine.
I am alive for the past 2 decades because of the support the Global Fund is giving to our nation.
The Global Fund's unwavering support has saved countless lives and continues to drive Zambia towards a future free from the burdens of HIV, tuberculosis, and malaria.
Again, I repeat the motto, nothing for us without us. It is the only way that we are going to make this work.
Join us in the fight. Together, we can end these epidemics and ensure a healthier, brighter future for all Zambians.